Dolly Arjun is a physician's assistant. She joins me now from Boston via Skype. A few years ago, she also founded a telehealth program to provide free healthcare to members of India's Indigenous tribes and to Dalits, the caste. First of all, tell me why you started that service.
So it wasn't a very intentional process. I'm from the community. I was there in rural India about 10 years ago, and because there's just no access for medical care for folks in rural settings, there is no hospitals in any rural areas. That's number one. Number two, it's very expensive for folks to get care there. So when I was there, I would see them in person. And then when I would come back to the US, they would keep in touch with me about what was going on or send me reports. And so it kind of evolved organically. And we know folks there on the ground, lab techs and nurses. And so there was a little community that formed. So we've actually been doing this for the past 5 years, and it's become a little bit bigger now and, of course, much busier.
It's a wonderful service. It's a shame it has to exist, but it's great that it does. I mean, as we said, it's for Indigenous tribes, but also for the Dalits, the caste. Briefly give us a sense of how Dalits fit into Indian society, or, as the case may be, do not, and how they are covered or not by healthcare.
Sure. So basically, one thing that connects all South Asians around the world is the caste system. And basically, it's a system of graded hierarchy. And Dalit people fall at the bottom of that pole, outside of kind of what's considered a human being. So essentially, those people, of course, are formally referred to as the untouchables, and partly because we are considered spiritually polluting, subhuman, and the untouchable caste actually comes underneath those who are considered slaves in the caste system, who are known as Shudras. So, Dalits and Adivasis, the indigenous tribes, are among the most economically exploited populations in India.
It's just hard to hear those descriptions. I mean, it really is. I mean, okay, so you're running this thing, how many calls are you getting a day? How many people are being helped by the service? It's taken off, hasn't it?
Yeah, so in the past 2 weeks, I would say we have between 15 to 30 phone calls per day.
Wow, that's a lot of people getting help. I'm curious, how frustrating is it for you being here, knowing what's happening in India, the tragedy that's unfolding?
Well, of course, it's very frustrating. Body's here, but mind and heart is over there. And it's also coming on the heels of kind of the pandemic work we've been doing here for the past year. So it's very frustrating and exhausting. And also, of course, the government response, or lack therefore of, is very frustrating too.
So what are you able to help? Somebody calls, you get a video call going. What do you help them with?
So many of our people have seen a medical provider, but they're being misguided in their care. An example is that the state government, for example, is recommending that everybody start 2 antibiotics, regardless of whether they are mild or moderate cases of COVID, which of course is a viral infection, so antibiotics isn't going to help. Folks are asking us for oxygen, for referrals to hospitals, for referrals to doctors, for food, for medication, money for all of that.
It's amazing. I mean, and in the bigger picture, I mean, do you believe, as many do, that there is one healthcare system for the well-off and another for the poor, that resources are just not fairly distributed?
Sure, the resources aren't distributed, and there's obviously a lot of bias among the healthcare providers who tend to be from more of the oppressor caste communities, and many of them don't even have experience with our communities. So there's a huge gap, both in terms of knowledge, both in terms of resources. And, a simple thing like in the UN report, there was recently shown that rural Dalit women live on average life expectancy 14.5 years less than a rural upper caste woman.
Wow. And you're doing this on top of your day job in Massachusetts, and you've just spent a year working with COVID patients during the day. I mean, this must be exhausting.
Yes. It's very exhausting. And even today, my day started at 6, and most of the day we've been seeing patients. I mean, 15 to 30 patients is a pretty full panel for the US. And so that's just in addition to the work we're already doing here.
Just quickly, you're Dalit, right?
Yes, that's correct.
And how is it for you to be doing this for your people, if you like?
Well, I guess what I want to kind of include here is it follows in the footsteps of Dr. B.R. Ambedkar, who wrote Annihilation of Caste. It's kind of, it doesn't feel like I'm doing like some kind of service or anything. It just feels like what I need to be doing in life. And It's very hard because it's been hard to recruit providers. We really need medical providers to help with our efforts, and it's kind of hard to get them on board with us.
You're doing amazing work, I mean, both in your day job and this, helping people in India. Dolly Arjun, thank you so much for what you're doing and for speaking with us.
Thank you so much for your time. I appreciate it.